Well, our group was composed of a group of wonderful, insightful folks from various organizations that include the Wilmington Health Associates, New Hanover Regional Medical Center, Community Care of the Lower Cape Fear, and CHEC, and the Cape Fear Clinic. We had wonderful discussions about patient engagement, which led us to say, well, what exactly is patient engagement? And that's the willingness for a patient to take hold and advantage of and responsible for their health and health condition. And then moving forward, when we talk about building the business case, if you will, so why do it? Engaging both parties and both providers, patients will, let me try this again. Engaging both providers and patients will improve the patient outcomes, their experience, lower costs, and improve the overall health of the population in our region. I mean, that's the value statement. That's why we say, gosh, if we get our patients involved, we can collectively make a difference. And it's not just a push, it's a pull, and we all work in the same direction. When we think about the current conditions and we think about the 4 top reasons for preventing patient engagement, what are the barriers, if you will, the first one that stuck out was the lack of understanding. Someone said, you know, when my child was diagnosed with a condition, once they said what it was, I couldn't process any further. And that's not uncommon. I sat across from the urologist when they said, your dad has prostate cancer. And I heard wah, wah, wah afterwards. And it's not uncommon to not be ready to process any more after you get something like that. And so you take it next to say, what's another barrier? And it's a lack of care coordination. I mean, how many times have you said, okay, all you got to do is get your blood work? That sounds good if you don't have to leave the office. But if you have to go to the lab across the way, or if you have to get your imaging there, or if you have to follow up at a consultant's office, you've got barriers. It may have been tough enough to get to the primary care physician. And so the care coordination comes the other way. We talked about how, you know, when a person gets a diagnosis, perhaps goes to the Big Blue, UNC for tertiary quaternary care, it's that coordination. I mean, we have these record systems. They're epic, but they don't necessarily communicate epically. And we got to get there. So, in fact, it was a parent serving as a go-between for communication, and that's another barrier. When we talk about limited resources, we looked at it from a big perspective of saying, okay, limited resources could be something as, I don't have enough money to go to the doctor, or I don't have transportation. The bus line drops me off in front of Burger King, and my office is down the road where I need to go to. And so there are plenty of barriers in that respect with regard to resources. And finally, lack of social support and the network. Each of us has a social support system we could draw upon. It may be our families, it's our spouses, it could be our friends, it could be our churches and other communities, but we draw upon them. But time and again, you come across people who, for various reasons, don't have that support. You could say, well, down on their luck, or they could say, well, gee whiz, they've made bad choices. But at the end of the day, without those social support, getting to the next place is going to be difficult, and getting engagement is going to be difficult. So when we talk about the proposal, we go forward and we say, we have to develop a model for care transitions. You know, if systems are going to succeed, it has to be simple to do the right thing. You have to make it easy for people to want to engage. And if you do that, you'll have a chance, a real chance to actually engage. And so we have systems in place that are developing and continuing to develop. One of the models we talked about is with Community Care of North Carolina, what they're doing with connecting and care coordination. Motivational interviewing. We were joking how you got to lose weight, you got to exercise, you got to, okay, so that sounds good. I've told someone they need to do something, but maybe that's not ready, where they're ready to be met. And maybe we have to understand, okay, so tell me about why you're having trouble losing weight. Tell me about how come you can't get to the gym. Tell me about what is the issue, and let's kind of work through it, because I'm sure you have the answer. We just need to figure it out. And so, and then utilize methods to engage patients. And this was kind of one of those aha moments for me. I've never heard of this, Ask 3. I've heard of the food pyramids and plenty of things like that, but Ask 3, what is the problem? What do I need to do, and why is it important to me? Well, those are 3 simple questions that every patient should be armed with when they walk into the physician's office. I mean, patient engagement isn't just the provider looking at the patient, it's the patient saying, hey, look, I'm a part of the process, tell me why this is important to me. And if we can get out that message, I think that would be pretty successful. Then we look at it from not just the local level, but take it from a regional perspective and a community level. And then you say, well, how can we engage the city, the county, our businesses and schools to engage in this process? We have school-based clinics. We have opportunities with law enforcement, with medics to basically connect. We heard about one city that was using the Postal Service to identify where people were in need, and those folks kind of knock on the door and say, Mrs. Smith, how are you doing? It doesn't have to be that complicated, but we have to be more creative. I mean, the solution is there. It's just, how do you think about it? So joining in existing groups is part of the solution, and figuring out those groups and those resources to leverage. And then finally, there's groups that are developing, that are being educated, called health coaches. You know, in every community, they have folks who are the real connectors, the ones who basically can speak to many different groups very successfully. When you talk pediatrics, you talk about the grandmother. If you really want things to change, you get the grandmother involved, because all of a sudden everything falls into place. It's remarkable. And health coaches is just another vehicle where you take folks who are educated, and we have them here, actually, the Cape Fear Community College. And you say, well, what's the business case? You say, well, you know, the Medicare yearly exam is something that they could bill for, and that's a pretty big exam. Not only that, but they can go out there and coach and say, look, tell me about why you're having trouble losing weight, and tell me how come you can't get on that treadmill, and what about that Fitbit and that jawbone? So we say, well, what are the things that we have and continue to do? And we see communities and practitioners and health systems adopting patient-centered medical home, and that's one of the solutions. And then we say, well, what are some of the, if we could get to December, and we said, okay, what would be a mark of success? I would say if we were able to leverage some of the folks who are there, so maybe a clinic within the Wilmington Health Associates, and maybe the Cape Fear Clinic, and maybe one of the other clinics at New Hanover, and say, okay, just this clinic, let's talk about teaching motivational interviewing, and let's see how you guys do. Does it really make a difference? Let's also come up with the opportunity to get tools to Ask Me 3 and put it in the waiting room. Do patients really use it? And do they actually start engaging more? Sometimes when you're sitting across from your physician and you're in a gown and you're in your shorts, it's not the most comfortable time to have these conversations. But yet you got to figure out ways to kind of help coach that experience to say, okay, here's the questions to ask when you feel like you got deer in headlights and vulnerable. And so that's it. All right.